Welcome. My name is Dr. Johnson. I hope everyone is doing well. Today we're be discussing emerging trends or current trends for treating children and adolescents. This field has been around quite a while with many best practices, but I think the most unique item for any counselor that's been practicing a while is the use of technology. Up until probably pre pandemic, I barely used technology the way we do today. It has opened up a gateway of uses. Many people are familiar with telehealth due to the pandemic, but prior to that, I've only had a handful of hours, whether using the phone or on video. And now there's a ton of training a counselor can go to just for telehealth, ethical concerns, best practices, you name it, it is now a hot button topic. So I do emphasize, even though this is being incorporated in a graduate program, to do additional training, especially if you plan on working in an online environment. Those that are school counselors, yes, you still may use it, but maybe not to the extent of mental health counselors. An example I just give is telehealth. You most of the time now you use a secure program, just like any other doctor's appointment. You get on, it's HIPAA compliant, which means it has end-to-end encryption. So you can't just use the typical pick up a cell phone and use it. It has to be end-to-end encryption, where that means when the information goes, it erases right after it's sent and received, which is pretty neat. And you would find out more about that in additional training. But consider the applications. Now I can see a teenager on a lunch break at school, just find a private secured area, and they can talk to me over the phone. And I can send a doctor's note excusing that time, which I have for whether it's a study hall break or a lunch break. And just realize, use your creative nature of how to best serve students. So now instead of signing out of school and coming and see me for 50 some minutes and then driving back, they could literally see me during their lunch break. So how cool is that? That it's not only helping the client, but consider the applications of even helping the school counselors, because now they're able to see me instead of maybe overwhelming the school counselors. That's just a one example, but as you move forward, just realize that you are entering the field in a very exciting time. As I stated, I done very handful up until a couple years ago, but now I lost count. I do them every week, multiple ones a week, and I think at this point I probably have at least 1,000 hours in the last 3 to 4 years. But I hope everyone has a great week. I'm excited to be talking about trends. I know today we focused on technology, but I'm excited to hear about any other trends people are willing to talk about in the discussion. Have a great final week, and I look forward to your discussions.